Hello everyone, Minkan Medical glad to introduce you our OH Series device, special for high-flow oxygen therapy. I will explain from the four aspects as followed. First, what is HFNC therapy? Let's start from the basic definition of the HFNC. HFNC means high-flow nasal cannula oxygen therapy. It's a new method of respiratory therapy and it is designed to administer a heated and humidified mixture of air and oxygen through nasal bronch. As the picture on the right, it shows the sputum in airway mucosa. When the humidity of the inhaled air increases, the airway mucosa move the mucocellaria to help sputum spit out. Thus, the advantages of the humidification will lead to best airway protection, mucociliary cleaning, sputum flowing smoothly, and reduced respiratory infection. Some patients or doctors will think the traditional oxygen therapy is enough for the basic treatment, but the disadvantages focus on the lower flow rate, dry airway mucosa, poorly tolerated mask, difference between the actual patient's inhaled and transmitted oxygen flow rate, and amount of the oxygen. So, the advantage of HFNC is very obvious on 5 aspects as followed. Let me explain them one by one. The first advantage, rapidly and effectively improve the blood oxygen. These two schematic diagrams show when we inhale high-flow oxygen or air, it could rapidly and effectively improve the blood oxygen than low flow. Meanwhile, high-flow oxygen therapy will offer a set fraction of inspiration oxygen to ensure the efficiency. The second advantage, the high-flow oxygen could scoring the physiological anatomy dead space to reduce the re-inhalation of carbon dioxide. The red image means the carbon dioxide sequestration in the airway. The photo was taken by 2D gamma camera to show how HFNC can significantly reduce the repetitive breathing gas in the upper respiratory tract. The third advantage, HFNC could maintain positive airway pressure throughout the respiratory circle. As you can see in the photo, HFNC can produce a CPAP, especially in the expiratory phase. The pressure level is closely related to the gas flow rate, and whether the patient has a mouth opening, it seems to be more effective for the female. The fourth one, HFNC could provide full humidification and heating. The fifth, the most comfortable experience for patients is they could talk, eat, and drink during the whole treatment. After introduce the advantage of HFNC. After introduce the advantages of HFNC, right now I would like to show you the advantage of our OH series. We invent the OH series to ensure efficiency of HFNC therapy from the 5 aspects: the automatic control of precise oxygen concentration, intelligent temperature and humidity control system, 2 to 70 liter high flow output, unique data storage, and no need disinfection on device and accessories. So this is the surface of oxygen adjustment. Our device controls the oxygen concentration with no manual adjustment, and concentration change could from 21% to 100%. 1% adjustment accuracy, built-in air oxygen blender, and built-in oxygen concentration monitoring module to make sure the efficiency. Our device uses intelligent temperature and humidity control to make sure the water automatically added. This is the surface of flow adjustment. Our device offers wide flow range from 2 to 70 liters per minute to wash the anatomical dead space. This is the surface of trend review. Our device offers trend review for temperature, humidity, and oxygen concentration. The device and accessories don't need to be disinfected because of the safe airway design. At last, let's see where could you use our OH series device in the hospital. The most frequently used department is emergency, vascular cardiology, ENT, geriatric, neurology, burn, rheumatism and immunology, cardiothoracic surgery department. As you could see, we have 3 models in OH series. OH 70C and 70B is for hospital. OH 60A is for home care. All the parameters and detailed information, welcome to contact with us by email, LinkedIn, and Facebook. Thank you for your listening.